was on it, which was for an airbag. The fuel engineer came in today, and then everything is good with the parts that we already talked about. The air pump and then the filter, I believe, is what it was, getting replaced. No other damage seemed to be caused to it. And then for the inside, Subaru is paying for it to get detailed. It probably won't be done tomorrow. I know you guys are going down to town. So we'll just pick back up on it probably first of the week and let you know when we're done. But if you have any questions for me, if you want to give me a call back this evening or even tomorrow, that's fine.
Hi everyone, welcome to Whole Body Spring Detox. I'm super excited today to talk to you about the importance of detox and what are the reasons behind a detox. So let's get started. If you have any questions, please hold them till the end of the webinar, and I will be glad to answer them at the end. There's a little chat box and we can do a Q&A at the end. Okay, so let's get started. So what is a whole body spring detox all about? So what's amazing about really focusing on the whole body as a detox, because a lot of times you'll hear someone say, oh, I'm going to do this great liver cleanse, or I'm going to be doing this great digestive cleanse. And it's really about the deep down cellular cleansing. It's not just about one area of the body. We really want to focus on the entire system to revive ourselves, not only on the physical, but the emotional, spiritual, and mental level. It's a whole body aspect. Okay, so what is a detox about, right? So first of all, let's talk about what a toxin. So the word detox has tox in it or toxin in it. So what is a toxin in general? So toxins come in a couple different forms. They come from, they're endogenous or exogenous. So an endogenous toxin is all about, it's from our cellular metabolism, how we actually metabolize. So when we are breaking down toxins, so to speak, or we're breaking down things that come into the body that are not needed, we do that through cellular metabolism. And we want our body to be able to do that efficiently. A xenobiotic or exogenous toxin is different. So it's a toxin recognized by the body and managed by enhancing cellular metabolism. It's not recognized the way we recognize something healthy in our body, such as a heavy metal or a pesticide, for instance. Emotional toxins, these are also part of the picture. That could be from, let's say you lost your job, or you had some fear about money, or anything that's causing from an outside factor can also be a toxin in the system. So when we're talking about really detoxing the whole body, we have to look at the emotional level. Also, mental toxins are part of the picture, and these are our loss of free will and expression. And that's a really important aspect of detoxing the whole system. So how do we get rid of all these toxins? We got, that's the best question of the day, right? So how do we do that? We're going to look at the body at a deep cellular level. Our cells have the amazing capacity to multiply, regenerate, so to speak, and they make a new cell. And let's say, for instance, you have all of these cells in the body and they're not functioning at a great level. They're not functioning up to snuff. They're not doing their job. And so then what happens is the cell will replicate, and that cell replicates as a poorly functioning cell. So when we're talking about detoxing the body at a cellular level, we want to get in there, get down in there, and really help the cells to open up and release the toxins. Super important. Okay, let's go to the next slide here. Okay, so health and balance. So when we're talking about detoxifying the system or cleansing the system, it's all about health, right? So what is health? Health is the reestablishment of homeostasis in the body. So that means when everything is at equilibrium. And then well, what does balance look like? A balance is a state in the body where the cells are living without any residual waste. Well, that's a great idea. But in the world that we live in, it's not, I wouldn't say it's like 100% attainable. Maybe because we're always working at getting the toxin. Of course, it is attainable, but our body's always shifting and trying to be in balance. And we live in a very different environment. Say if we were growing up, 60 years ago or something, when the environment of the planet was different. The cars were different, everything, the EMFs, the cell phones, everything around us is changed. And so we're bombarded with toxins all the time. And for us to stay in balance now, it's not just like, oh, I'm going to wake up, my body's going to be great, it's going to be homeostasis. It's actually like wow, today my body actually needs to work harder to, maybe you were exposed to some smoke. I was in a little car accident or car situation last week and I got exposed to smoke. So my body has to work harder to be able to get that out of the system. So also a state of balance is when the body is in an alkaline system, an alkaline balance. We want to make sure that our body is staying in an alkalinity and not going to an acidic state, because when our body is in an acidic state, I kind of like to think of it as living in battery acid. You know, so our body is really acidic. We want that body to be balanced, so it's not having to fight to bring back that homeostasis. We also have to, when our body is fighting off viruses, that is a hard place for us to be, and we need to bring that back into the balance. So viral functions or viral attack can bring the body out of balance. And when the intake of outside substance is exactly what the body needs, that's when we're in balance. So what does that look like? How do you know what your body needs? You know, communicating with your body, testing what your body needs, really listening. You know, these are all skills you develop during a detox, because we're going to be eliminating foods that might be triggers to kicking us out of balance. And so when we fall out of balance, it's harder, of course, to get back into balance and in alignment. Okay, so I also wanted to talk about what disease is, or dis-ease, because disease is really a state which happens in the body on any level when there's an imbalance on a physical, spiritual, emotional, and mental level. And so when we're talking about the detox, we want to get our body out of the state of dis-ease and back into a state of balance. And that is not always an easy place to be or to do if you're in a chronic disease place. So one of the things I think is important if you are thinking about starting a spring detox is to really check in with your primary care physician or a naturopathic doctor like myself. And you know, that's because you want to make sure that your body's ready to jump into detoxing. And the important part about that is I tell my patients that we are a tube. We have several different aspects of elimination. We have our lungs for breathing. We have our colon for eliminating fecal matter. We have our kidneys for eliminating urine. We have our skin. So we have lots of different ways to eliminate. But if those tubes of the system or those systems are not able to eliminate, what happens is you're going to have the tube will be blocked, right? And then with that comes a state of disease, because we can't eliminate the toxins. And if you're going to try to eliminate something without a tube being open, it can a lot of times make you feel a lot sicker or to have go into crisis mode. So it's important to check in with your primary care physician. I don't know, did I mention who I am? I think I got so excited about talking that I don't know if I mentioned who I am. So let me go back to this slide here. I'm Dr. LuLu Shimek, and of course I'm so excited to be here to talk to you today that I think I didn't introduce myself. Silly me. So anyway, I'm the naturopathic doctor at Piney Clinic for Integrated Healing, and we are excited to bring you webinar series, and that is free education with a small little webinars where we're giving you a taste of what we do here at the clinic to help you elevate your health. Okay, so let's go back to, where were we? We were talking about this one. Oh, I love this slide. Okay, how do the cells play a role in detox? So physiology. When we're talking about our cells function at a physiological level. The systems are always doing something. One system is doing this. Let's say, for instance, your thyroid system is helping with your metabolism. So how do those cells play a role in detox? If we understand how our system and cells work in the body, we understand much more about how our body ends up in a chronic disease state. And chronic disease really starts with multiple organ system imbalance. You know, I think I don't know if you guys can see me. I want to check something here while we're going on. I think you can see me, so that's good. I'm sharing. Let's see what's happening. Okay, there I am. I don't know if you can see me, so I want you to make sure you can see me. You don't really need to see the slides because I'm going to talk you guys through everything anyway. Okay, so there I am. I love working with the computers. It's so exciting. Okay, so where were we? How do the cells play a role in detox? Yes. So it really starts with conception. So as our body is being conceived, as we are little humans on the planet, in the conception state, that's when our cells really form. It's actually really even in preconception, where it's our parents ahead of time, right? What our parents are doing, how they are living their lives. So in one sense, if you're interested in conceiving, it's a great time or thinking about getting pregnant, to talk to myself or another alternative health practitioner about how to get your body in the ultimate prime state to have the healthiest conception, because we want to make sure our bodies are healthy to pass on the best genes that we can to our children. Okay, the next slide here, I'm going to switch back over. I want you guys to see this, this amazing, let's see, I want to be here. Okay. All right, this slide here. Okay, this is a cell. Isn't that so cool? I love all the stuff that the cell does. All right, so our cell has all of these different aspects. So if you think about this cell, and it has, you could see it has these little kind of kidney bean shapes here on the left. That's a mitochondria. That's our energy powerhouses. We also have the nucleus of the cell, where we have our DNA. We have our rough endoplasmic reticulum. We have our plasma membrane, our lysosomes and Golgi complexes. So our cells are complicated little individuals for being so tiny. So if the cell is in a toxic state, the wonderful nutrients that we're absorbing from our food can't pass through the cell, or pass through the cell membrane, I should say, into the cell to allow the mitochondria, our energy powerhouses, and the nucleus of the cell to make great DNA, or to replicate DNA. So it's important that we're recharging the ribosomes of the cell and the mitochondria, because we want our cells to be functioning at 100% capacity. So they're giving us all the energy that they can. And so a lot of times what I see with patients who have fatigue is that they actually have a poor cellular function. Their cells are not working properly. Their mitochondria are not able to reproduce fully. So say you have a toxic cell, it's filled with all these toxins, and you're trying to make a new cell, and you have one mitochondria in the cell. So what's going to happen? You're going to make the new cell with one mitochondria. But what if your cell is like, woohoo, it's off the charts, it functions great, it's got this super amazing, clear, clean, toxin-free zone, and it's got multiple mitochondria. And then that's going to create another cell filled with energy. And that's exactly what we want, right? So we have to go in and we have to clean out the toxins from inside the cell. All right, I'm going to go back to the camera so you guys can see me. There I am. Perfect. Okay. Our next topic is the stairway to health. So as we're talking about health, health is a journey up several different stairs. And as we go up the stairs, we increase our health potential. We really want to go the distance and believe that we can get to that highest potential. But when we're in a toxic state, it's hard to get to that spot. So as we move down the stairs of health, we decline in health. And so what are these stairs, and what are some of the ways that we can work and get to that top stairway of optimal health? So we have at the bottom, of course, we're going to have chronic disease and then degeneration. We have abnormal cells and disease and dysfunction. So that's kind of like that bottom tier. Then we move into signs and symptoms. So, as your body's starting to feel a little funky, excuse me, not quite right, then we have signs and symptoms, and you usually go to the doctor like, oh, you know, I've been having this chronic sinus infection for months. I can't seem to get it to go away. So then when we investigate, right, the detectives come out. Next level is nutritional stress. So actually not getting the right nutrients your body needs for optimal function. Chemicals and environmental stress are a key factor in how we live and how our body functions and on the stairway to optimal health. How we eliminate, as I was talking before, the different aspects of elimination. How does our body eliminate? Are we eliminating up to 100% capability and function? Are we having structural stress? So is actually the spine of our system out of alignment and causing the organs to be out of alignment, for us to be having nerve pain, or maybe we're having shoulder issues. Emotional stress. So that plays a really key factor, especially I've been seeing a lot more of emotional stress as we continue to have a more stressful society that we're living in. It becomes more challenging. Hereditary. So the actual gene pool that we come from plays a big factor on our stairway to optimal health. And we have a great practitioner here at the clinic, Andrea Lotti, and she will analyze your genetic makeup through 23andMe, and then with specific things like, say you wanted to have your genes analyzed from a supplemental aspect, what actual, maybe you have a hard time making or metabolizing vitamin D. Your genes can tell you that. You're like, oh, no matter how much vitamin D I take, I can't ever get it to absorb into my system. Maybe you're not a good metabolizer of vitamin D. So that's just an example of hereditary genes that you might have gotten passed down through generations. And the top of the stairwell is the restoration of function. That's our supreme stairwell, right? Where we are able to restore with complete ease and grace. Okay, so let me go to the next slide here. So how are we going to remove these cellular toxins is really our key. Let me pull it down a little bit better so you guys can see me better. So when we're talking about removing the cellular toxins, we have 4 main steps. 1, recognize what the toxin is. So I have a great toxicity questionnaire that I give my patients to help me see the whole system. So if that's something that you're interested in, just contact me at the clinic or make an appointment. We can go over that together. Neutralizing the toxin. So we recognize it, we want to neutralize it, and then we want to eliminate it. We want to get it out of the system. And then the key factor of all of this is really restoring cellular DNA, because we want to make sure now that our DNA is functioning up to 100% capacity of its ability. You know, once the DNA is corrupted, we really have to get in there and help it to regenerate. Okay, so requirements for cellular healing is our next step. So now we've talked about what the aspect of a detox is, or, you know, really what's happening in the body at the deep cellular level. But what do those cells need to actually heal, right? For the actual requirements of the cell. So we need to have rest. So during a detox or your spring detox that you're thinking about and have coming up, you know, what I really recommend is scheduling the time in for you to have to rest. Because if, for instance, okay, I'm going to do this amazing detox, and then I'm going to be working my full-time job, and I'm going to be, you know, spending time with my family and cooking all the meals. I'm like, whoa, you have to really plan out. It's not something you can jump into without the plan, because there's different stages of rest. We have the physical rest. This is what allows your muscles to actually rest, right? And stretching during this resting period will allow the toxins to flow out of the system with much more ease, right? Because we want to get those muscles stretching, get the body moving. So exercise is just as important as resting, but resting is key. Also, physiological rest. So fasting for 18 hours with enhanced techniques to increase your elimination, because we want to make sure that you're eliminating fully and efficiently and giving your body the real ability to rest. and physiologically for that to rest. So if you think about eating, you know, we're eating all the time, stuff's coming into the system, and especially when we're eating a lot of animal protein, our body has to have time to take a break, because we want to be able to just, okay, thank you for feeding me and acknowledging the great job you're doing. But when we just take a rest, even if it's for fasting for overnight once a week, it really, your body says, I have a break. Thank you so much. I can just kind of like recharge. As you know, our bodies are made of, they're batteries of their energy, and we want to give that battery the time to rest. Also, mental rest is very important, especially if you're in a high stress state. You want to give the mental system a time to relax. The brain, the actual central nervous system, requires sleep to recharge and recover. So if we give ourselves the ability or the time to relax on a mental level, we need at least 7.5 hours a night for that recharge. You know, sleep, I think when we're talking about resting and recovering and rejuvenating, restoring the system, sleep is like really the key player, because our body rejuvenates at night. We need to have that time to be able to relax. Everything is tuned out, right? You know, dreaming is a way that our brain is active, but it's a different level of communication, right? It's on that spiritual level. Okay, I want to talk next about cellular damage. So how do we damage the cells, right? And, you know, we come into this world with these great cells when we're born with, and, you know, not everyone is born in optimal health, but most of the time we're born with a great set of cells. So how do we make specific lifestyle choices to then have cell damage? So poor diet is really a key factor in this, as most of my patients know that are tuning in tonight. You know, it's not always easy to make the right choice for optimal nutritional health. You know, sometimes we falter, and, you know, that's just part of life. You're going to have the ebb and flow. But making consistent poor nutritional choices damages the cells, especially if it's a food that you have an inflammatory reaction to. And I'm going to talk about that tonight, what that looks like for the system, what a food sensitivity is, and having food intolerances, and how we can help figure out what poor nutritional choices are causing damage to the cells on a daily basis. Insufficient sleep, which I talked about. Also, sleeping at the wrong time of the day. So, you know, it's really hard, you know, if you have a nighttime job or, you know, working the night shift, it's challenging for your body in general. But I'm talking about, you know, sleeping, having insomnia, having aspects of the night where you're not sleeping through the night, and then taking large naps through the day, which then throws you off. Lack of exercise and movement. So exercise is key, because the cells have to have circulation, and then the circulation allows things to be eliminated. So if we don't have the actual circulation happening, how are we going to eliminate? Exercise increases cardiovascular output, right? It speeds up your heart rate. It allows us to speed the blood to circulate and to not become stagnant. Toxic water, so drinking unfiltered water, or water with a lot of chlorine, or water that's contaminated. So making sure you're drinking a clean water source. Overwork is a big cause of cellular damage. Working, not giving yourself a break, not giving yourself the time for a vacation, time to relax with your family. Stress is one of those key factors. We're talking about, like, you know, sleep, stress, and I guess you could say stability might be the third one. But if I could find a great word for, like, nutrition for stress, I'll have to think about that one. But yeah, the 3 S's, but 3 is stability, because stability is our pyramid, our tower, what we put, our foundation. We have to have the foundation, the pillars for everything, right, to be on. So then we also have the way that all those work together is that they create free radical damage and lead to chronic inflammation. And once we have inflammation in the system, our body is always fighting. I gotta work harder to be able to get the inflammation and leave out of the system. And then we have to break that inflammation cycle, which causes us it can be challenging sometimes to break that cycle, but it's a pain loop. We get in there, we break the inflammation cycle. We allow your body to have a break from the inflammation, and that's from getting rid of the cells that are damaged, replenishing the cells with amazing cells that are then healthy, right? Healthy cells, great. I want to have healthy cells. I do have healthy cells. Okay, next I want to show you guys this picture. If you're tuning in with a phone and not seeing the video, you can do that later. You can check in later. Okay, I want to show you guys this awesome picture of the body buckets. Okay, so I use this analogy a lot with patients because it's easy and it's really kind of, it's really not easy to understand. So if we think of our body as big buckets, everything is going into the bucket every day, right? So we have our poor nutrition, we have our stress, we have our overwork, we have mental and spiritual stress, we have EMS, we have pollution, you know, everything goes in the bucket. Not to mention what our, you know, the genes, our genetic makeup for specific diseases. So all the stuff's going into the bucket. As this bucket becomes more full and bigger, this spigot, the outflow of the bucket becomes clogged. And then what happens is the bucket overflows, causing, so if we put all these toxins into this bucket, medications, toxic food, toxic homes, heavy metals, mercury in vaccines, our genes from our prenatal and from our mother, if we put all that into the bucket, and then we say, okay, body, process this for me, then the bucket starts to overflow, then those toxins go everywhere into the system and they cause disease. So we want to make sure, again, that all those emunctories, those organs of elimination, are open, clear, and ready to relieve the system. So again, those are our lungs, the kidneys, the skin, and our GI system. Those are our primary ones, digestive tract, liver. We have our secondary emunctories, so our secondary modes of elimination. That's our skin, our musculoskeletal system, our mucous membranes, and our mental emotional changes, our mental emotional body. Okay, I'm gonna go back to, you guys see me here? Ta-da, there I am. Okay, the next slide here I wanna go over is the goal of a detox program. So, you know, what is your goal? You're thinking like, great, I wanna do the spring detox. What does that mean? I'm just gonna drink water for 24 hours and see, you know, gonna do a fast, see what happens. But we're talking deeper. We're talking about a 21-day spring detox where you're really getting in and diving deep down into what's happening for your system. So we want to, the goals that I think are really important about a spring detox are, number one, aid the process of detoxifying the body to recreate balance. Balance is key, right? Balance is everything we do on that foundation of health. Balance your organ systems, all of the organ systems, so they're all functioning at prime level. Improve and enhance natural immunity. We want to intervene on all levels of disease. So if you're already in a disease state, we want to intervene and stop the disease from continuing forward and then prevent further disease from happening. Address the underlying dysfunction or root cause of disease, really being the detective and figuring out what's going on. And again, prevent future health problems or prevention. So those are really the key goals of doing a detox. It's not just, I mean, it is about feeling better. And of course, all those things I just mentioned help you feel better. But we really want to have a specific goal set as we're moving forward into a detox program. Okay, so why do we eliminate, right? And why should we do an elimination? That's a big part of a detox program, is that eliminating foods, eliminating triggers that are triggering us to have cellular damage and be living in a toxic state. So food allergies are a super big one. So that's why we want to do an elimination. We want to allow our body a break from chronic inflammation. So when we ingest food that our immune system mistakes as harmful, then we have a food allergy, right? So peanuts is a prime example of that. Like, oh my gosh, this is harmful for me. I'm gonna have an anaphylactic reaction. So that's a food your body needs to eliminate all the time. Our body acts by creating antibodies. So antibodies, these are their fighter cells, right? They're going, they're like, woohoo, something's coming into this system. I need to attack. So then the body creates those antibodies. It's specific for a allergic reaction, but our body then can become sensitive or intolerant. So I'm going to talk about those. These antibodies are little fighters. They signal a systemic-wide inflammatory response that can be life-threatening. So that's, again, that anaphylactic reaction. That's like a real extreme, like a food allergy. And that's something you don't want to keep ingesting, right? But then we have a food intolerance. So a food intolerance occurs when you eat a food and it irritates your digestive system or another part of your system. The most common case is really when someone doesn't produce a substance or underproduces a substance required for the digestion of that particular food. For example, lactose intolerance. The most common food intolerances are most always the ones that are most commonly eaten. Wheat, milk, corn, because our body doesn't have enough variety of different food groups in the body. So these are not immune mediated. We're not going to have the antibodies attacking for a food intolerance. They're happening because your body lacks what it needs to properly digest the food. And again, it's also the total load. So remember I talked about the bucket concept. Again, if you're filling the bucket with all of these sensitivities, more, say you only decided the only food group I'm going to eat forever the rest of my life is, corn. Maybe on a corn diet. Well, of course, your body's going to develop an intolerance to that, and it's going to want something different because we need to have variety. It's what feeds us. And then also, symptoms of food intolerance. So how do you know if you're having food intolerances and the key to when a cellular detox is good for you, right? So some of these common food intolerance systems are nausea, stomach pain, diarrhea. This is the most common one when you have a food intolerance. Vomiting, gas, cramping, bloating. So those are very common food intolerance symptoms. So then we also have so we have food allergies, food intolerances, and then we have food sensitivity. So we have three categories when it comes to eliminating foods from our system or our nutritional program. So in food sensitivity reactions, this is what we really want to be testing when we're doing an elimination or a spring detox or a detox program. This is referred to as a delayed sensitivity response. So delayed reaction not only involves the immune system, but creates chemical reactions that cause a cascade of inflammation and immune complexes. So it's not just one reaction, but then you'll have this cascades into this, which then causes that reaction, which then causes that reaction. So you might be asking yourself, well, like, wouldn't I know if I had a food sensitivity? But most people have like totally long forgotten that they've had the food sensitivity because they got the signal over and over again from the body. Signal, 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 and then the body tuned out the signal. So initially, when they ingested that food particle, the body said, that kind of irritates me. I'm not really a fan of that food group. But then something in the mind takes over or food cravings take over. Who knows what stress. And then you eat more and more of that food and your body just says, well, I guess I'm just going to try to adapt to what you keep on giving me. And then that creates a cascade of inflammation, which then leads us to a chronic inflammatory state. So we really have to learn to listen to the early warning system. And so to do that, we have to fully eliminate foods that could be possible triggers. So not until one or more systems have become more seriously dysfunctional does the body make another attempt to let you know they're a problem. That's like the key message right there, right? So you body tunes out, you keep on going, you're like, okay, cool, I can manage this, I'm doing okay. Then your body says, all right, this other system then is not going to work so great. And then another system doesn't start to work so great. So then your body says, okay, I got to send some big messages because you're not listening to me. And that's when you go into that chronic disease state. So it's really key to remember that all symptoms are important attempts by the body to communicate with you and provide direction for the mind in response to dysfunction. They are signaling for a change, right? Please make a change. And we are so good sometimes at ignoring the messages from our physical body. Not always, I think maybe ignoring some of the other things, maybe like an emotional stress, Some people are good at ignoring those too, but I think a physical one is a lot more easier for some reason for us to ignore. Okay, so we talked about food sensitivity, and what are some of the food sensitivity symptoms that you can have in everyday life? They can blend in because they're not life-threatening. It's not the anaphylactic shock that you might have had from the peanuts. So you can have moodiness, brain fog, feeling that spaced out feeling, headaches. They're vague headaches that come and go, intense food cravings for sugar, gluten, dairy, corn, etc. Fatigue. So fatigue is a huge one. Due to the inflammatory response or immune response, you're not getting enough nutrients. So your body's constantly taxed by the inflammatory response, which causes fatigue. And another symptom is heartburn or acid reflux and joint pain. So those are some just general food sensitivity symptoms. So if you're having either one of these symptoms all the time or multiple, it's usually multiple, that's a key factor that you need to do a cellular detox or a spring detox. Some other food sensitivity symptoms are skin issues like acne, rosacea, dark circles under the eyes or puffy eyes, digestive issues, gas, bloating, constipation, and diarrhea, sinus issues, nasal congestion, and runny nose, emotional issues like anxiety and depression, asthma, wheezing, seasonal hay fever, hyperactivity. We see that a lot with children with ADD. They will have gluten sensitivities, and so that's a really key factor for them. Weight gain or inability to lose weight, that's usually a key factor for food sensitivity. Cardiovascular disease and kidney disease, addiction, sleep disorders, autoimmune disease. I mean, the list just goes on and on. So there are a lot of key factors for food sensitivities, which is why I really recommend doing a spring detox or a cellular detox that's guided by myself or another physician so that we can recognize these food sensitivities in you and then help you eliminate and then re-challenge them. So food cravings, I think this is a really interesting one. For instance, I did this elimination and then now all of a sudden I just feel like I'm craving food again, or I can't get rid of that craving. So food cravings are often an indication you're under a great deal of stress. So how are you managing your stress? Are you able to manage it? Do you have the key resources? Have you talked to someone about how you're managing stress? When you eat a food you're sensitive to and it doesn't digest well, the undigested bits or food then permeate your gut and enter your circulation where they don't belong. The antibodies then rush to the scene, creating an immune response. But it doesn't just create enough antibodies for that one time, it anticipates another attack. Another attack on the system. And then when it has all these antibodies and nothing to break down, they crave it. And in turn, so do you. So does that make sense to everyone that's listening in? So we call to the scene these antibodies and they don't have anything to break down because it's not something that they're really challenged for. So they then in turn crave it more. They want to have more of it. They're like, woo, I need more of that. More, give it to me. And in turn, so you have those cravings. Symptoms of food cravings, how do you know if you're really having a food craving, except like you run out the store and eat a bar of chocolate? Last from food symptoms, cravings can really last for about 45 minutes to 3 days after ingesting that food particle or food group. So that's really important. And as we do challenges and elimination, then we see that. Any organ in the system in the body can be affected. Woo, that's amazing, right? So it can be any part of your system can be having those problems. Usually chronic and occasionally acute. It's estimated that 20 to 30% of our population is affected by food cravings and having or the reactions to food cravings. And then this is an immune-mediated process. Again, that's that chronic inflammation cascade I was talking to you about earlier. That's what this is all about. Okay, so how do you know if you're having food sensitivities? That's what I was just talking about. So what I'd like you to do moving forward into, you know, okay, is a spring detox meant for me? How is my body in a toxic state? Well, you probably already know, or you probably might not be tuning into this call today or this webinar. What I want you to do is to first list out the key symptoms that I talked about today. Are these symptoms affecting you? Are you having these symptoms? Then what I want you to do is make a list of foods you suspect you're sensitive to and include cravings and reactions and symptoms, right? Let's say, for instance, you know, well, all I want to do is eat cheese every meal. Well, that's most likely a craving and a food sensitivity. You know, I speak with patients a lot about food cravings, and you know, they say, well, I don't really think I can eliminate dairy. I just love it so much. I'm like, well, it's most likely causing you, it could be causing you some type of food sensitivity. And until we eliminate it out of your diet, we're not going to know. And so that's really a good light bulb that comes on for patients. Like, oh, yeah, if I'm craving it, my body might be actually creating a food intolerance or food sensitivity, causing myself more undue harm. Okay, so again, how do you know that a detox is right for you, that a detox is key? Making a list of your symptoms, thinking about the overall toxic load. How's your bucket looking? Is it full? Is it overflowing? And then also making a list of foods that possibly are causing you sensitivity. So let's talk about what that means from the detox standpoint. So the detox program that I do when I work with patients, it's a 21-day program. We're in the first week, we're eliminating every all alcohol, caffeine, sugar. We're eliminating all sources of animal protein in that first week. We're also eliminating all grains except for quinoa, all beans except for lima beans and lentils. So we're really allowing the body to have a clean slate to work with. Then the following 2 weeks, what we do is we reintroduce animal protein to allow you to have some more fuel to work on, so to speak. And in conjunction, you're still only doing that major source of animal protein 1 meal per day. So you're still allowing a slower input of food and nutritional sources. Then after that 3 weeks, some patients do a longer period of time. After that 3 weeks, we do a reintroduction. And so that reintroduction phase it's called challenge phase. Say, for instance, okay, the major food groups that we want to re-challenge after we've taken them out of the body: dairy, corn, grains, sugar, alcohol, caffeine. Sometimes I'll have patients eliminate the nightshade family, and that's our tomatoes, potatoes, eggplants. And then also sometimes the citrus family, because those can be causing a lot of excess acidity in the system and causing chronic inflammation. So sometimes we'll eliminate those and re-challenge them as well. It depends on what the diet is. And I look at, when I recommend a detox program, I have patients do a detox questionnaire that gives me a range, an actual numeric gauge for how toxic their system is. That's a great thing to do, because then after the detox program, you can do the detox questionnaire again. Like, oh, look, I went from a 70 to a 20. Woo! Great, right? We did our job. But the other part of that is we want to make sure that detox questionnaire, I lost my train of thought. Detox questionnaire. Anyway, because we do the detox questionnaire, that gives us a ground framework to work from to see if it's needed. Most of the time, you can tell, right? You're like, if you're coming to see me, most time you're in a chronic disease state. We need to get you up and out of it, up and moving forward. So when we eliminate those foods, we still have that clean slate to work with. So we start reintroducing those foods, one food group at a time. We challenge that food, and then we have a chart that we use to record our symptoms as we're challenging the food. If it's something that you have an extreme sensitivity to, sometimes patients will know immediately. Sometimes I'll have them even divide foods more, not just like a food group, but then divide them out. Like, okay, and we're gonna do change up the grains. So we're going to do gluten grains, and then we're going to do non-gluten grains to really see if you're having sensitivity. We're going to do egg yolks and egg whites. So really seeing deep down if there's an actual cause to sensitivity in the system. And then also, if these food groups are causing you chronic inflammation, you see a huge relief. It's amazing. Like patients, even after a couple of days, will say like, oh my gosh, I've already lost weight. My pan size has gone down. I mean, this can be even after 4 days of eliminating these really chronic inflammatory foods. It also, their friends and family see a difference in their emotional and mental health. So you can see a lot of changes. It really also depends on the level of toxicity. How deep ingrained is that toxicity in your system? Because it can take, if you've been living in a toxic state and you've been having this chronic disease state, let's say for, let's just say 10 years. So if we do a 3-week elimination, we might not get to, everything eliminated that's been building up over 10 years. So it takes time. So a lot of times what I do with patients, we do that 3-week elimination and then we have a base point. We challenge the food groups that might be challenging or causing sensitivity. We then have a great diet and framework to work on, and then we can still have less food intake as we're moving forward and having supplements that we add in to help decrease inflammation and clean out the system, clean out the liver, clean out the kidneys, clean out the lungs, clean out the digestive system. I didn't really talk about too much about the organs of elimination. When I do the detox programs with patients, I talk a lot more about the organs of elimination, why they're important. But I do want to touch base about constipation. That is the key factor. When patients have a history of constipation, I immediately get them on an elimination program because they haven't been eliminating when you have constipation. All those toxins are building up in the system and they're causing toxicities. Basically, that bucket is so overflowing, it's about to almost like explode, right? So we've got to get you eliminating. So the detox or purification program that I do opens that up immediately. It allows everything to start flowing through, and patients see change in their bowel movements within like 2 to 3 days. It's great. Okay, so I think that's all of the main points I wanted to address. If you're interested in doing a detox program with me or more information about the detox program, you can contact me at the clinic, at Epiney Clinic for Integrated Healing. You can make a 15-minute free appointment. We could talk about it too. I can also send you some information, a PDF of the toxicity questionnaire. I think I can post that on our Facebook page. So I can do that too underneath this webinar, so you can have that. So yeah, there's lots of ways to reach out to me and other members of the clinic to help you with the detox program and to see if you're ready. Like I talked about in the beginning, you want to have it doctor guided so that I can guide you, and when the toxins start to hit the fan, so to speak, we have you primed and ready to eliminate. So this is a great time to ask questions. This is our Q&A time. So if you have any questions, you can put them in the chat window, and I will answer any chats that you have. So now's a great time to ask any questions about what I've talked about today, any questions about detoxing, any questions about eliminating or food sensitivities, how that works. And you can also post questions on our Facebook page like, oh my gosh, I listened to the webinar and I forgot to answer a question or ask a question. I mean, be more than happy to answer a question on our Facebook page. Okay, I think that's it. Nobody has any questions right now. They're probably, the questions of detox are swimming in their head and they can't wait to get started. I'm excited to start with you guys for our spring detox, which is starting the spring equinox, which I'm really thrilled about. So if you are ready to jump on board, then now's the time. And this is key because in spring, we're releasing all of the winter, all of that darkness. And then, that we've been in not that it's been cloudy and dark, but releasing the winter energy and getting the spring energy to move forward. So that's why spring detoxes are so important. A lot of times people do a detox with me in the beginning of the year because that's important too, to get the energy moving. But spring is all about the liver. It's when it's really flowing and moving. And so we want to encourage our body to detox at this particular time. And we don't just do, at Epiney Clinic for Integrated Healing, we don't just do a detox once a year. We do them several times a year because it helps us to get into the mood, the groove, and for really to help our body to be at optimal health and eliminating properly. Okay, thank you so much for attending this evening. And I've enjoyed telling you and sharing my love and joy for Detox. I hope you learned a lot. And again, if you need more information, you can contact us at the clinic, or you can email us at info@epineintegratedclinic.com. Okay, thank you so much. Enjoy the wonderful weather. It's snowing here today. So it's spring, but snow. It's spring snow. So have a great evening, and I will talk to everyone soon. Bye-bye.